Hello viewers, welcome again to our program. It's another new week that we want to discuss about breastfeeding, and we are together with my colleague Steve once again. Steve, karibu.
Just like you said that we want to discuss and know something about breastfeeding, and just like in case you are not aware, August from 1st to 7th is normally the World Breastfeeding Week, and we are standing together with the health professional that may promote breastfeeding. And basically breastfeeding is to help us mitigate the causes and the chances of malnutrition among the young children even as they age up. So welcome even as we run through this program that is going to enlighten us more about breastfeeding and things we need to know, and finally how breastfeeding is linked to cancer, knowing very well that we are trying to advocate so much when it comes to the issues with cancer in our life.
Thank you so much. As we know very well that breast cancer, all this we are doing, we are advocating for cancer. Ways to prevent, ways to detect, ways to manage, and if someone is in the position to prevent, then it's better they prevent cancer as early as possible before it affects the entire family or the entire community. One thing I want to say is that both men and women are getting breast cancer. They are getting infected with breast cancer. But today we just want to look on the side of how does breastfeeding help in reducing chances or risk on breast cancer. But before we come to that, we just want to look into the entire breastfeeding, benefits of breastfeeding to the mother, benefits of breastfeeding to the child. Yes, so that at the end of the day we shall also look at how does breastfeeding also reduce risk factors on breast cancer, especially for the female. Now, Steve, to start with, I don't know if is there any way to define breastfeeding?
Breastfeeding comes from that term you are feeding by use of maybe food from the breast.
Yes.
And we know the food in the breast is basically the milk. And so breastfeeding is entirely putting a child nutrition on a mother's milk.
Yes.
And it is advocated that we recommend that children should be breastfed for the first 6 months exclusively before engaging on complementary feeding. And that one does not mean that after complementary now you stop breastfeeding, no. But now breastfeeding comes along with complementary feeding. But breastfeeding basically is to totally depend on the mother's milk for the nutrition of the young boy. Okay, breastfeeding has got a lot of importance to the mother and also to the child. And of course, let us start with how is breastfeeding important to the newborn. Number one, we understand that breast milk contains all the possible nutrients we need in correct amount and in every possible proportion that you may need. And number two, breast milk is easier to digest compared to other food, because we know that when a child is born, the system is still weak to engage on like hard foods. And even the GI tract is not even yet able to accommodate such kind of food. And also, breastfeeding also boosts that bond between the mother and the child. There is that emotional and psychological bond that is normally developed. And there is also science behind the improvement of the IQ, the knowledge development, when you are able to just engage a child on purely breast milk. And also, breast milk contains antibodies, in that the breast milk is able to defend the child from possible infection at an early age. Then finally, I can talk that breastfeeding is able to maintain the child without being affected by the common GI tract diseases and also respiratory diseases.
A child that has been breastfed and the one that most probably by bad luck the mother has passed, before getting lactated. Now, these two children there, they have got, there are some difference. What are some of the differences?
Of course, when you breastfeed a child, of course, will be different from a child that is engaged on bottle milk. Of course, maybe a parent dies, or maybe the child was born and just lost his or her reflux, that is the ability to suck the milk from the mother's breast. And among other factors that we can say, the most important negative aspect of a child that has not breastfed is on the part of the bonding between the mother and the child. Because, of course, if we talk about the nutritional part of it, this child might be breastfeeding from the bottle, but it was the same milk from the breast. So it's still having all the nutrient and everything. But the part that we might miss is the part of the bond between the mother and the child. And that has got a very big impact on even how the child is developing at an early age, to the point that now he's able to gain to know what is good and right, and also to detect who is this person that I'm with. What are some of the situations that may lead somebody not to breastfeed? And number one, we have those women who are afraid to breastfeed in public, and particularly the young mothers that fear, like she doesn't want people to know that maybe she gave birth. And also number two is the issue with occupation. Sometimes the mother is the breadwinner, she has to go to do some small jobs to be able to feed. So that can also be a factor as to why the mother cannot breastfeed. Another one is it is believed that the digestion of formula milk takes at least a longer period of time. So sometimes mothers can prefer formula milk to be able to maintain the satiety level of the child. That is, to be the child will feel filled up without getting hunger fast. And another thing is that they normally believe that caregivers are able to give the bottle milk at regular intervals, reducing the frequency by which you can engage on that.
Now, if you look into this, is there any risk that this one imposed to the child?
Of course, there has to be a risk. And number one, we can talk at the hygienic level. Because we do not know that how is the storage of this milk. And again, we can talk on the aspect that if we talk of this, the common non-bottled or sucking, normally caregivers don't really clean the bottle well, because you see the bottle has some sharp-pointed end. Getting into that end to clean it thoroughly may pose a challenge. So the issue with that kind of feeding comes from the possible infection of this milk, which can pose health risk to the child. If you are able to give in the correct amount, to that you are not limiting the amount you are giving, is still but okay, because we also have mothers who die then immediately after giving birth. So the issue is all about how you storing this milk, the hygienic levels, what we fear so much with these other milk that don't really come directly from the mother.
Okay. Now, if a woman does not breastfeed, and then at the end of the day, does this one impose some risk on her?
Yeah, there are possible risks, and that one again we will talk on them as we finalize on the possible causes, how breastfeeding can link us to cancer issues. But the common one is the pain. Actually, when the milk is so much filled up in the breast, that is the common issue with the pain. Then again, issue to do with cleanliness, because when you don't breastfeed and your breast is full of milk, there is that possibility of the milk starting to sneak out, and it can bring that bad image to the mother. So those are some bad factors which will narrow down as we finalize.
Okay.
And now, if we talk about some bad importance of breastfeeding to the mother, number one is that breastfeeding lowers the risk of ovarian and breast cancer, which we are going to discuss as we finish. And again, while breastfeeding, there is that burning of excess calories that is helping to reduce the pregnancy weight that was able to begin over that period of expectancy, I think gestation period, of course. There is this thing we call the ABCs of breastfeeding. Some factors that we need to consider as we breastfeed. And so ABC is just but abbreviation standing for some meaning. And so A is the awareness that as a mother you need to know and detect that is this baby hungry, that you have to feed the baby on demand, what we call feeding on demand. Yeah. Then the B part of it is be patient. As you breastfeed, you need to just be in a relaxed mode, in an environment that even if the child is going to breastfeed to the sleeping level, you just be patient until the baby leaves what we call latching in his or her own. You don't try to
remove
stop
the baby.
You don't stop the baby from continuing breastfeeding. Then the C part of it is comfort, that you need to be relaxed, because when you are relaxed, the milk is able to flow freely and you are able to produce lots of milk for the child. So the ABC is just but abbreviation that when you're breastfeeding, you need to be aware of your child's need and demand. B, you need to be patient as you do that noble task. And the last part is that you need to be in a relaxed mode, being comfort as you do breastfeeding. That is recommended.
And now the hygiene of the mother. Let's say she has gone to work, coming back home, and then she wants to breastfeed the baby. Should they just continue, or they can have to bathe, wash the breast, and then they feed? Or how can they avoid it?
Of course, cleanliness is key when it comes to breastfeeding, and that is also tied to the kind of activities you are engaging on. And of course, I will advise that after a long day's work, considering that you went to a far place, you traveled forth and far and wide, upon coming, there is that possibility of met a lot of stuff along the way. And so it is good to maintain that.
Okay. Now, what are some of the common challenges that a mother can face?
Some of the challenges that a mother can experience is sometimes you have the desire to breastfeed, but you've got like inverted nipples.
Yes.
You know, sometimes we have women that their nipples are not projected outside. That's like going inside.
Yes.
So those are some part of the challenge you have. Another one is the sore nipples. Sometimes your nipples are having pain, so you fear that the baby might bite them and cause some serious irritation. And also again, sometimes you might be having cracked nipples, and so it is advisable that the kind of oil you are engaging yourself in, or the kind of soaps, should be not that which can crack or cause damage to your nipples. Make sure you are on a healthy diet, having all the food group. That is the protein diet, the carbohydrate diet, the vitamin diet, and also minerals and lots of water also. And that is what we can say. And sometimes we normally have this edema development, so you can engage on but just a minor exercise, like if you're in the house you can stretch out, and to even help the system to be in the good mood and stabilize your metabolic reaction.
Okay. And now let us come back to cancer. You mentioned ovarian cancer and also breast cancer. How does this one come about?
Okay, thank you so much. Ovarian cancer is sharing the same link with breast cancer when it comes to breastfeeding. Actually, those who are breastfeeding have a lower risk of developing breast and ovarian cancer. So breastfeeding is all about reduction of the menstrual cycle, hence lowering that hormone estrogen that will otherwise lead to much production of the cancer cell. And also breastfeeding lowers the risk of ovarian and breast cancer, because it's believed that as you breastfeed, people normally adopt a healthy lifestyle. And that is why it is linked that somebody who's breastfeeding is normally by nature just come up with a healthy lifestyle. Yeah.
Okay. So women should be they should be breastfeeding.
Exactly.
Okay.
Yeah.
Because of time, sometimes we may not get time to discuss everything. And I hope that our discussion for this week is going to impact mothers. It's going to impact our young women. And before we close this program, I just want to if you can talk, if you can say something about these young ladies, most probably that they are aborting, they don't want to give birth, they use contraceptives in relation to breast health.
Okay, that is all about taking responsibility. And to the young mothers, one of the challenges you normally pose is the one we mentioned, the fear to breastfeed in public, which is majorly affecting the young mothers. And so, as a young girl, a young lady outside there, what we can say is that if you're not ready to bear the responsibility of having a child, or if you're not ready to accept the new name of being a mother, you should not reach the level of you being expectant to get a child. Wait for the right time if your psychology is stable enough to accept what comes with giving birth. And so it is not good to even think about issues to do with aborting children. In fact, it is uncalled for young girls, just because they don't want to be mothers, you abort. If you're not ready for something, don't go for it. And that is why we need also mothers to be strong enough to be able to bring their children in a very stable atmosphere, to be able to maintain a healthy life without thinking that premarital sex activities is what solves some life challenges.
Just to add on what Steve has said is that if you are not ready to take care of a child, then you need not to get into this indulge yourself into this kind of premarital sex. Otherwise, thank you so much, and I hope we shall also bring another program next week. And I think all this we are discussing more benefiting to our life and our health. Thank you so much. Steve, your last word.
As nutritionists, we just want to stand with the World Health Organization, who are currently campaigning, and also other organizations in partnership with the WHO, that breastfeeding should be embraced by all mothers. And we were doing this in solidarity with other health professionals to advocate for exclusive breastfeeding, that we may know the importance of breastfeeding, understand how breastfeeding is of help, and also to understand the importance of bringing a child on a breastfed nutrition or milk. And so, viewers, we want to say thank you so much, even as you always stand with us, and even as normally say that if you need more questions, normally contact us by our lines, because we normally give but little information. There are lots more which we will not be able to give because of the limited time and the airtime.
Thank you so much, and I hope we are going to meet next time. May God bless you.
Okay.